Ramipril. This is one of the angiotensin converting enzyme inhibitors. Want to know more about this medication? You're in the right place. Without further ado, let's go. Hi everyone, I want to talk about Ramipril. Have you heard about that before? Okay, Ramipril is an angiotensin converting enzyme inhibitor. Well, by the time we'll be done, you will probably need no question any further. With that in mind, let's go. Like I've just said, Ramipril is an angiotensin converting enzyme inhibitor. Other examples in that group will include benazepril, captopril, cilazopril, enalapril, enalaprilat, fosinopril, lisinopril, mezipril, perindopril, quinapril, tradulapril. We have to note something here. Ramipril is not good for blacks. If you're a black guy or a black woman, Ramipril is not the best for you except you have diabetes mellitus. Not as useful as in whites or Asians when it comes to Ramipril. So what I'm trying to say here is that when blacks, whites, Asians would need this medication, whites and Asians will benefit from its use than blacks. In other words, if there are other alternatives for the same ailment, it's better to use those other alternatives in black patients. Blacks will have more angioedema than whites and Asians. Ramipril could be known depending on your jurisdiction, and the pharmaceutical company supplying Ramipril in your zone could be Altace or ACEI Ramipril, APO-Ramipril, or AG-Ramipril. Like I said, the class is angiotensin converting enzyme inhibitor, and we use Ramipril as an antihypertensive. So someone is having hypertension, could take Ramipril. In congestive cardiac failure, we can use Ramipril. In myocardial infarction, whether ST elevated myocardial infarction or non-ST elevated myocardial infarction, or even post-acute treatment on maintenance, we can use Ramipril. We can use Ramipril in diabetic kidney disease because it has renal protective effect. And it's not only Ramipril that could do this, all angiotensin converting enzyme inhibitors could do this particular job, that is renal protective function. In left ventricular dysfunction, imagine someone with left ventricular ejection fraction below 45%, you can use Ramipril. But I'm not saying using Ramipril is enough because you need implantable cardiovascular defibrillator. But if you want oral medication to help, Ramipril is good. And individuals with kidney problem or diabetes mellitus and hypertension, Ramipril will be the best. As a matter of fact, Ramipril is even now incorporated into the management of diabetes mellitus. So it's a kind of cardiovascular risk reduction process. Ramipril could appear in various forms. The capsule is either generic or Altace. You can find it at the strength of 1.25 milligram, 2.5 milligram, 5 milligram, 10 milligram, or 15 milligram. You can swallow the capsule whole. You may choose to open the capsule and mix the content with water, apple juice, or apple sauce. The mechanism of action of Ramipril is essentially the same with all other medications under angiotensin converting enzyme inhibitor class. It prevents angiotensin 1 from being converted to angiotensin 2. It undergoes enzymatic saponification by esterase in the liver to the active metabolite. The active metabolite here is ramiprillate. The ramiprillate binds to angiotensin converting enzyme, preventing the formation of a strong vasoconstrictor. The hemodynamics is essentially that the onset of action is between 1 to 2 hours, and the duration of action is up to 24 hours. It is well absorbed by oral and has high protein binding capability. Monitoring and dosing. Anyone on Ramipril should have the blood pressure monitored. You have to monitor the renal function test, particularly the blood urea nitrogen, creatinine, and of course, measure the potassium. Why is the potassium so important? I'll go into that later on because hyperkalemia is a big problem with angiotensin converting enzyme inhibitors. And when the potassium is high, you keep your Ramipril off the table. Measure the complete blood count. Why that? We'll go into that in a bit. Monitor the above regularly with BP within the first 2 hours of administration of Ramipril. Then the rest, you can measure them every 2 weeks. When you are dosing, when you are giving Ramipril to patients or you are a patient, you are taking Ramipril, the ideal situation is to start low. Start with a very low dosage, then titrate based on the desired goal. For example, desired goal might be a particular level of the blood pressure. It's difficult for me to say categorically the value you should be expecting because it depends on the goal. For example, if you are dealing with diabetes mellitus and the individual is not having high blood pressure, so you know you are not expecting anything to be high. But generally, anyone with diabetes mellitus will expect the blood pressure range of nothing greater than 130 over 80 millimeters of mercury. So you can start from 2.5 or 5 milligram, and maybe you can even start with 1.25 milligram, depending on the blood pressure, the age, and the desired goal. In pregnancy, Ramipril will cross the placenta, and that could cause injury, malformation, and death to the fetus. Ramipril could also lead to oligohydramnios, and with oligohydramnios, there's likelihood of lung hypoplasia, decreased renal function, and skeletal malformation. And there's possibility of anuria, hypotension, renal failure, skull hypoplasia, and fetal death. And because of that, we don't prescribe Ramipril to pregnant women, and we don't feel comfortable prescribing Ramipril to women of childbearing age that could be pregnant without having contraceptive measures in place. So Ramipril should be taken off the table when dealing with pregnant women or women that could have pregnancy while on Ramipril. Ramipril is no good in pregnancy. What are the possible adverse effects? Hypotension. Yes, hypotension. Even when you are using Ramipril for purpose of preventing cardiovascular risk in people with diabetes mellitus, you have to be careful as far as the blood pressure is concerned. So it depends on the value of the blood pressure. For example, someone is having the BP of 80 over 60 millimeters of mercury. I won't administer the Ramipril under that situation. Okay. Now, cough. Yes, particularly captopril will give annoying, unproductive cough. And of course, orthostatic hypotension, commonly in the elderly. And that will also lead to scenario like syncope, angina pectoris is possible. Anyone on Ramipril could develop headache, fatigue, dizziness, and vertigo. Still on side effects or adverse effects, there's likelihood of chest pain, hyperkalemia. Hyperkalemia. This is one of the major trouble while on Ramipril or any of the enzyme inhibitors like angiotensin converting enzyme inhibitors. Hyperkalemia. There's possibility of vomiting, increased blood urea nitrogen, kidney, and renal insufficiency. Granulocytosis is possible while on Ramipril, and also bone marrow depression. And with that, there's likelihood of decreased hematocrit. So anemia is possible while on Ramipril. Captopril, which is a member of that family, could be associated with neutropenia, granulocytosis, anemia, thrombocytopenia. That's not surprising because we're going to be dealing with bone marrow suppression. There's likelihood of cholestatic jaundice, fulminant hepatic necrosis. As far as drug interactions are concerned, I'll leave that to your pharmacist because the list is pretty long. So we got it depending on what the patient will be taking concomitantly at the same time while on Ramipril, because I cannot just go now into the details, just too long for my presentation right now. But if someone is on only Ramipril, no problem. But Ramipril could be used under so many situations to handle many situations in different patients, and it can be on different other medications, and particularly maybe having so many other different comorbidities. So I'll leave that to your interaction with a pharmacist, or you may do research on your own. Contraindications: hypersensitivity to Ramipril or any other angiotensin converting enzyme inhibitors is enough not to give the medication. There's what we call hereditary idiopathic angioedema. Angioedema could develop in anyone taking Ramipril. So if that history is in this patient, I'll keep my Ramipril off the table. Don't use Ramipril with aliskiren or sacubitril. So you need to know the history of the medication the individual is on, just as what I've just said, while making reference to drug-drug interaction that I'll not be able to go into the list because it's just lots the pharmacist will guide. For example, someone is on sacubitril or aliskiren, don't give Ramipril. Someone is having bilateral renal artery stenosis, keep Ramipril off the table. Or the patient is having just one kidney, that is unilateral single kidney. Don't give Ramipril. Hemodynamically unstable patient, like I said, now the patient is before me, the blood pressure is 80/60 or lower. I will not give Ramipril. Hyperkalemia, you check the potassium level is higher than the normal range between 3.5 to 5.2 or 5.5, depending on your jurisdiction. I will not give Ramipril because Ramipril on its own will keep the potassium. But like I said, it depends on the situation you are handling. If this is heart failure and the patient is on LASIS and you have your Ramipril, LASIS will send out the potassium, so you could just keep an eye on the potassium. It's not likely you'll be dealing with hyperkalemia if you have Ramipril with LASIS. Congestive cardiac failure with hypotension, anything that gives hypotension, please be careful so that you will not think you are helping the patient, but actually killing them. Renal impairment, of course, with bilateral renal artery stenosis, single kidney, or hyperkalemia, or high level of blood urea nitrogen or creatinine, or renal insufficiency, keep Ramipril off the table. Pregnancy, don't need to waste your time going back to that. I've just talked about that a while ago. Breastfeeding, for the same purpose. Warning. I don't like giving warning, but for the sake of safety of everyone, Ramipril is not expected to be given in women of pregnant age group and not on any form of contraception because you could get sued. Why? The woman could become pregnant anytime, and before they will even let you know they're pregnant, the organogenesis stage is past, and all sorts of anomalies could ensue. Not in any woman planning pregnancy. Let me explain. A woman is right before me at the clinic wanting to be pregnant. I will not be comfortable to prescribe Ramipril. And with that in mind, come to the end of presentation as per Ramipril. It's a good medication. We use it a lot, particularly in patients with diabetes mellitus. Now, we've gone through all the contraindications, warning, dosage, and other members of the same class called angiotensin converting enzyme inhibitors. If anyone is hypersensitive to Ramipril, you can use angiotensin receptor blockers. And with that, saying thank you for listening to my presentation. Kindly subscribe to my channel so that you can get these presentations immediately they're published. I appreciate it.